part of what we want to do is to reduce the amount of restraints that occur in patients. We strongly feel that unnecessary restraints are inappropriate. And so typically these restraints are either physical or they're medical. And we certainly recognize that restraints are necessary. But the reason why people have restraints in facilities, other than obviously facilities that are oriented toward criminal action, where somebody's being restrained because they're in serious danger and they're psychotic, or they themselves are a criminal, those restraints are different. But I'm talking about the patient that's being given too much Xanax that makes them sundown, or the patient that has too many antipsychotics, or the patient that gets really agitated and then has to be held in their bed. Those are the restraints that we want to get rid of. And that's done through a deprescribing formulation. But you can't get to deprescribing. You can't get to deprescribing unless you make these people metabolically healthy. So the thing is, the mitochondria in the brain, which is what produces the energy, if they're starving because the patient is diabetic and they're insulin resistant, it's going to create an issue. Those patients are going to effectively be anoxic. They're not going to have enough energy to make good decisions. And so they typically will end up wandering. They typically end up being violent. They typically end up having nearly psychotic breaks. And those patients are the ones that get restrained. And when you get to a facility and those patients are restrained and somebody sees that, that doesn't make them happy, because it makes them wonder, well, are they going to do that to my family member? And so what we want to do is we want to minimize the total amount of restraints. And this is to the point also where the Department of Justice and the Center for Medicare Services recognize that restraint reduction and restraint-free facilities are the way to go for the future of care. Now, there are indications for restraint, but those are rare and far in between. And that's what we want to help identify. If somebody in the facility says, hey, this patient really does need to be restrained, then you're going to have backup. You're going to have data that says this is why we had to do it. So you don't have a review agency going, oh, they restrain everybody. Well, no, we have a specific criteria, and the patient has met that criteria, and we had to restrain for their safety or the safety of people around them. Whereas we do everything we can to reduce the risk of restraint.